Some Halloween stuff. So what do you understand your knee problem to be? This is a pop quiz.
Oh. Well,
What do you have wrong with your knee?
It's what do you call it? The meniscus
That's right.
is the basic cause of all this,
And,
and my incessant kneeling. And
yeah, you're always working on your knee, but is there arthritis?
oh yeah, there's arthritis too.
Right. And that is the main thing. So I'm just going to give a demonstration of Graston. And what happens is when you have arthritis, it becomes bone on bone, and all the muscles and ligaments and tendons become very fibrotic, so this helps. So I'm going to show how this is done. So I'm just going to angle this at about 45 degrees, 30 degrees or so. And try not to scream for the video.
Okay.
I'll try not to scream too.
This means I'm going to get an extra special good job this time.
I'm going to do a great job today, as opposed to any other time. I'll just push harder. Oh no.
I'm glad I was on time today.
Me
I
too.
don't want to miss my debut on
You're going to be famous.
YouTube.
Famous on YouTube. So one of the things about this Graston is you can actually feel different angles and where the scar tissue is, and it'll amplify what I feel, what I can normally feel with my hands if I were to do myofascial release or an active myofascial release. So this just makes it easier for my hands, and also it tends to be more effective, especially around certain joints. So now what I'm going to do is I'm going to put some biofreeze on it so it'll be a little less irritated. And now I'm going to analyze the joint play of the knee. So when people have arthritis, the joint tends to not move good. So this is the tibia, this is the femur. You knew that, right? There's going to be a test at the end.
Oh.
Yeah. And so the tibia and the femur, the tibia should rotate like this on the femur. So I'm going to place my fingers right there. I'm going to rotate the tibia outward. I'm going to rotate the tibia inward. And typically with osteoarthritis, the tibia will not rotate inward. So what I'm going to do when I do an adjustment is I'm going to distract the arthritis and rotate it to give it more play. And so it's not rotating that way. So what I'm going to do is I'm going to have you straighten your knee, John. There you go. What I'm going to do is I'm just going to rotate the tibia, stabilize the outside, and I'm just going to traction it. Perfect. Can you feel that give when I do that? Like a little traction, or no?
No, I just feel my
Your whole body going?
jerking.
Yeah.
Yes.
I'm going to edit the word jerking out, because then we get demonetized for profane language. Do you know that? You can't do that on YouTube, yeah. So now I'm going to retest the joint play, rotating it in, and it actually has a lot more play there right after the adjustment. Okay, so let's check your back now. Go ahead and stand up for me.
How about rattling? Is that better?
Rattling I don't think is a bad word. I could rattle people, but I can't jerk them.
Yeah.
Yeah, jerk is a bad word. Okay, so I'm going to do some Mackenzie with the arthrostim. So lean back for me and come back to center. And lean back. So this is an example of McKenzie protocol for disc problems in addition to the arthrostim stimulating L5. And it's as simple as that. All right. Thanks, John.
I'm glad I didn't know those
Big terms.
facts.
Well, people like it. It makes you sound important on YouTube.